Pop quiz. A 79-year-old post-op client, day one after a hip fracture repair, who was oriented this morning and now acutely disoriented, pulling at lines and saying, "I can't breathe." Vital signs 158 over 86, heart rate 112, respirations 24, O2 sat 88% on room air, temp 98.8. Current meds include morphine, PCA, and I can never say the name of this drug, Benadryl, diphenhydramine, given 1 hour ago for itching. What is a nurse's priority action? A, administer lorazepam for agitation. B, apply oxygen via nasal cannula, elevate head of bed. C, increase the morphine PCA dose for better pain control. Or D, turn off the lights and allow uninterrupted sleep. What would you do? I hope you all went with apply oxygen via nasal cannula and elevate head of bed. So first of all, what's going on with this patient? They're delirious, right? All the signs are there. First of all, we have an older adult, suddenly confused, and they just had surgery. So what do you think is causing the delirium? Infection. Most likely that's what's going on. But that's neither here nor there. The question is, what's going to be your priority action? Let's look at the options. A, administer lorazepam for agitation. You administer lorazepam for agitation, you don't understand the significance of what's happening here. And that lorazepam is going to worsen that patient's condition and just cover up the symptoms. So we're not going to do that. C, increase the morphine PCA dose for better control. So here we are. We have a patient that's acutely delirious. We look at the respirations, and the respirations are 24. O2 sat is at 88%. Let me tell you something. Once that number hits 91, that patient's in respiratory compromise, okay? This patient's O2 sat is at 88, and your bright idea is to go ahead and give them morphine to make it worse. Does that make any sense? No, we're trying to keep our license, so we're definitely not going to do that. And then D, turn off the lights and allow uninterrupted sleep. Yeah, we're going to let you die in peace. That's what you're telling the test writer if you chose that as the answer. You have to recognize the situation for what it is. This patient is in respiratory compromise, right? They need oxygen. And let me tell you something. When a patient cannot breathe, the very first thing you're going to do before you even give them oxygen, you're going to sit them up. Because the minute you sit them up, that diaphragm that's sitting up against the lungs, it's going to be able to expand. It's going to be able to push down so that the lungs can expand and that patient can breathe. All the abdominal girth that's pushing up against the lungs, right? It's not pushing up against the lungs so the lungs can expand so the patient can breathe. The first thing you're going to do is sit them up so that when you do give them oxygen, the oxygen will have somewhere to go, okay? The correct answer is B.